We know that communication is essential to delivering good quality, safe and dignified care to our patients. If we can adapt our communication to meet the needs of the individual in front of us, I firmly believe we can make a practical and palpable difference to the health inequalities experienced by people with a learning disability, such as those with Down syndrome. I encourage all health professionals, if you haven't already, to look locally to your hospital, trust or region for training around multimodal communication, such as Makaton. This will equip you with the expertise, such as learning to use signs or gestures and symbols, to communicate effectively with patients you encounter who rely on these tools to understand and be understood, and give these patients the time and space to advocate for themselves.